Hello, my name is Zainab Iman Kashim, and this is my presentation on sickle cell anemia, which was my research topic. On this presentation, I'll be going over Introduction to Sickle Cell Anemia, where I'll be discussing the history, molecular basis of sickle cell anemia, cellular level changes, symptoms and complications, diagnosis and treatment, and my citations. Sickle cell anemia is a genetic blood disorder characterized by the production of abnormal hemoglobin, known as hemoglobin S. This abnormal hemoglobin causes red blood cells to become rigid and adopt a sickle or crescent shape. These misshapen cells are less efficient at carrying oxygen and can block blood flow, leading to various complications like pain episodes, organ damage, increased risks of infections, and anemia. The disorder is inherited in an autosomal recessive pattern, meaning a person needs to inherit two copies of the sickle cell gene, one from each parent, to develop the disease. Sickle cell anemia was first recognized in the early 20th century. In 1910, Dr. James Herrick, a Chicago-based physician, documented the disease while observing the peculiar sickle cell-shaped red blood cells of a patient from Grenada. This was the first time the characteristic sickle cell shape of the red blood cells was described in Western medicine. The origins of sickle cell mutations are believed to have occurred in regions of Africa where the traits provided a protective advantage against malaria. This genetic adaptation was passed down through generations. The term sickle cell refers to the distinct shape, as we see over here, of the affected red blood cells, which impairs their ability to carry oxygen efficiently. Sickle cell anemia at the molecular and cellular level involves the following key components: hemoglobin S, the molecular cause of sickle cell anemia, is a mutation in the beta globin gene of hemoglobin. This mutation leads to the production of abnormal hemoglobin known as hemoglobin S. Under lower oxygen conditions, the hemoglobin tends to polymerize, causing red blood cells to become rigid and sickle-shaped. Red blood cells carry oxygen throughout the body. In sickle cell anemia, since they're crescent-shaped, they lose their flexibility and are prone to breaking apart easily. This sickling of red blood cells leads to blockages in the small blood vessels, causing pain and sometimes organ damage. RAC and GTPase and F-actin. These are cellular proteins involved in maintaining the structure and flexibility of the cytoskeleton of RBCs. In sickle cell anemia, the altered functions of these proteins contributes to the reduced deformability of the cells, their properties to assume a sickle-shaped. On a cellular level, RACGTPase emerges as a pivotal actor in the dynamic orchestration of the cytoskeleton, operating as a regulatory force. It exerts influence over the assembly of F-actin, a crucial building block of the cellular cytoskeleton. In sickle cell anemia, deficiency of RAC1 and RAC2 GTPases disrupts the normal hexagonal organization of the RBC cytoskeleton, leading to decreased deformability of erythrocytes. This is associated with increased phosphorylation of adenosine, a condition that decreases F-actin capping and leads to dissociation of spectrin from actin, significantly impacting cytoskeletal remodeling. Increased ROS concentration is also observed in sickle erythrocytes, which plays a role in the pathophysiology of sickle cell disease. Within the molecules participating in the signal cascade, RACGTPase assumes a role of paramount importance in shaping and structural integrity of cells. This disturbance plays a significant role in distinctive sickling phenomenon observed in red blood cells, illustrating the profound impact of molecular irregularities at the cellular level on macroscopic manifestations of the disease. Cellular level changes. We have deoxygenation. The primary trigger for sickling of red blood cells is low oxygen levels. When hemoglobin S is deoxygenated, it tends to polymerize, causing cells to sickle. Repeated sickling and unsickling. Cycles of sickling and unsickling of red blood cells can damage the cell membrane, making the cells more fragile and prone to hemolysis. Increased blood viscosity. Sickle cell blood cells and the resultant hemolysis increase blood viscosity, which can impair blood flow and lead to vaso-occlusive crisis, inflammation and endothelial damage. Chronic inflammation and damage to the blood vessel walls can worsen the disease, leading to further complications. Symptoms and complications. We have anemia. Due to the rapid breakdown, sickle cell leads to shortage of red blood cells causing fatigue. There are pain episodes, also known as pain crisis. These occur when sickle cell blood flow leads to an extreme pain. Swelling of hands and feet results from blood circulation blockage. Frequent infections. The vulnerability is due to spleen damage. Delayed growth of puberty, caused by shortage of healthy red blood cells. They have vision problems. Sickle cell can block blood vessels to supply the eye, damaging the retina. Complications of sickle cell are stroke, caused by blocked blood flow to the brain. Acute chest syndrome, due to lung infections or blood vessel blockage in the lungs. High blood pressure in the lungs, potentially fatal, which is pulmonary hypertension, organ damage, splenic sequestration, blindness, leg ulcers, priapism, deep vein thrombosis, and pulmonary embolism, and pregnancy complications, which is increased risk of high blood pressure, blood clots, causing miscarriage, and low birth weight babies. Diagnosis of sickle cell. The blood test to check for hemoglobin S. Hemoglobin electrophoresis to identify different types of hemoglobin. Newborn screening in many countries, genetic testing to confirm the diagnosis. Treatments for sickle cell anemia. Pain management with medications like NSAIDs or opioids during crisis. Hydroxyurea to increase fetal hemoglobin productions. Regular blood transfusions to reduce anemia and prevent strokes. Vaccinations and antibiotics to prevent infections. Bone marrow or stem cell transplants, which can be curative. This is a new treatment called gene therapy. It includes recent advances like CRISPR-Cas9 gene editing as experimental treatments. It is currently in its clinical treatment trial. These are my citations. Thank you for watching my presentation.